Welcome to the presentation on measures of morbidity for undergraduate medical students. At the end of this session, we intend that students should be able to interpret the measures of disease occurrence and burden and should be able to use appropriate indicator to measure either occurrence of disease, that is risk, or burden of disease. This quote emphasizes the importance of quantification and measurement in gaining a deep understanding of a subject. When we can measure a phenomenon and express it numerically, we demonstrate a certain level of knowledge about it, as we can analyze, compare, and draw conclusions based on those measurements. However, if we cannot measure or quantify a subject, our knowledge of it remains limited and often unsatisfactory. Without quantification, it can be challenging to effectively communicate our understanding of a subject, make predictions, or develop evidence-based strategies and interventions. In this context of epidemiology and public health, measuring and quantifying disease incidence, prevalence, and risk factor is crucial. Precise measurement allows us to identify trends, evaluate interventions, and allocate resources effectively. This quote serves as a reminder of the importance of measurement and quantification in our quest for knowledge and understanding. Now we will discuss about definition of morbidity. Morbidity refers to the state of being ill or diseased and represents the presence of a specific disease or condition in a population. Morbidity can be both acute, which are short-term illnesses, and chronic, which are long-term illnesses. Morbidity encompasses both physical as well as mental health conditions and can be measured using various indicators such as prevalence, incidence, and disability adjusted life years, quality adjusted life years, etc. Why we should learn about morbidity measures? Understanding morbidity measures is essential in epidemiology and public health for several reasons. First, morbidity measures help assess the overall health status of a population, which is crucial in determining the health needs and priorities of that population. Second, these measures help identify high-risk groups and vulnerable populations, enabling targeted interventions to improve the health outcomes. Morbidity measures also play a significant role in monitoring trends of disease occurrence over time. This information can help identify emerging health issues and evaluate the effectiveness of healthcare interventions and policies. Additionally, morbidity measures inform resource allocation and priority setting for public health initiatives, ensuring that resources are directed to areas with the greatest need. Furthermore, morbidity measures guide the development of prevention and control strategies for various health conditions. By understanding the prevalence and incidence of disease, public health professionals can develop targeted strategies to prevent and manage these conditions effectively. Lastly, morbidity measures provide a basis for public health research and surveillance, enhancing our understanding of the relationships between various determinants of health, including social, economic, and environmental factors. This knowledge ultimately contributes to the development of more effective and equitable public health policies and interventions. Prevalence is the proportion of population with a specific disease or condition at a given time. It helps us understand the overall disease burden and identify high-risk groups. There are two types of prevalence. One is point prevalence and another is period prevalence. Point prevalence provides a snapshot of disease occurrence at a specific time. For example, let us consider the number of people with diabetes in a city on January 1st, 2023. We can calculate point prevalence by dividing the number of people with diabetes on that date by the total population on that date. This slide shows total population of 296. These are population from the different household. So if this is the total population, now what will be the point prevalence in this population of a particular disease? This is indicated by the red dots, which you can visualize here. Now Out of the total population, 17.07% of the people have disease. So this is nothing but point prevalence. It gives you a snapshot. Then there is a concept of period prevalence. It is measure of disease occurrence over a specific period. For instance, let's consider number of people with diabetes in a city during the year 2023. We calculate period prevalence by dividing the number of people with diabetes during the year by the total population during that year. There is an interesting prevalence public health paradox. I will give you an example. So when insulin first became available, what should have happened to the prevalence of diabetes? Prevalence increased because diabetes was not cured but only controlled. So there were more number of people with diabetes now because it was controlled, but it was already there. So whenever a new measure is introduced that enhances survival or detects the disease in more people, the net effect is an apparent increase in the prevalence. So it occurs when death is prevented or prolonged and disease is not cured. So this is prevalence public health paradox. In this slide, we will discuss two key factors that influence prevalence. First is disease duration and another is new cases. The longer disease lasts, the higher its prevalence will be, as more individuals are living with the condition. Chronic diseases like diabetes and hypertension tend to have higher prevalence due to their long-standing nature. On other hand, new cases, also known as incidence, can contribute to increased prevalence. Implementing effective prevention and control strategies can help reduce both the incidence and prevalence of the disease. Then, population dynamics also plays a crucial role in determining the prevalence of disease. Demographic factors such as age, sex, and migration can influence the prevalence of specific conditions. For example, age-related diseases like dementia are more prevalent in population with higher proportion of elderly individuals. Understanding these factors can help tailor the public health interventions and target resources more effectively. Finally, we will discuss the role of case detection and reporting as well as healthcare system in influencing disease prevalence. Accurate and timely detection and reporting of cases is essential for understanding the true prevalence of disease. Underreporting and misdiagnosis can lead to underestimation of the prevalence, which can have significant implications for public health policy and resource allocation. The healthcare system and access to treatment also plays a vital role in determining prevalence. Areas with limited access to treatment may experience higher prevalence due to longer duration of active disease and ongoing transmission. Improving access to care and treatment can help reduce prevalence of certain diseases.